Hello there, this is Dr. Scott Mosser at the Gender Confirmation Center of San Francisco, California. I have a question here that I'm going to answer, which is, what are the types of double incision scar shapes? For example, straight or curved? Great question, and I think we need to think about this two ways. Sometimes there are anatomic constraints which partially determine the shape of the incisions. And sometimes there are patient preferences, which influence the techniques that we use to end up with different incision shapes. I think the most important thing for a patient is to know what they prefer. To look at a number of different double incision top surgery photos for people that have a body that's similar to theirs, so they can get a good comparison, and then decide whether or not a subtle, gentle curve. We never want a deep curve. That's never ever something that is desired for the surgery. So we're not talking about a U-shaped curve, but a gentle curve that's along the lower muscle border that might eventually hide well within the muscle shadow if a patient gets athletic and develops some muscle structure. If that is desired, a gentle curve, or if really no curves on the chest would be much more euphoric for a patient and much more desirable, in which case we try to make things as straight as possible. So sometimes the incisions need to join in the middle, and if they're straight, of course, they would join in a straight line in the middle. Sometimes if they join and the patient's got a curvature, most of the time we do not want that to be a point. Most of the time we want it to be just like a little bit of a hill almost in the center of the chest, so that there's nothing that is too reminiscent of the structures of the breast in terms of a final incision shape. So there might be a lot more to talk about on this subject, but I think those are the basics. And the main takeaway here is think about this, think about what you want, and then be careful to articulate that to your surgeon so that they can choose a technique and an approach that gets you where you need to go.